Dr. Heather. How are you doing today? Yeah, okay, what seems to be the issue? You hit your head. Okay, do you mind if I take a look really quickly? Yeah, okay. Okay. Yeah, it seems like you have a pretty nasty bruise going on up there. So before I refer you to, sending you to the emergency room or anything like that, I'd like to go ahead and just quickly do a cranial nerve exam just to see if there seems to be any damage of any kind, or if it's just a superficial bump on the head kind of thing. Would that be okay with you? Great, okay. So just a couple of quick questions to start out with. Can I get your full name and birth date? Great. So when did this head injury happen and how did it happen? Okay. Playing football. Okay. Yeah, we see a lot of this, especially this time of year. So you ran into another player, is that what happened? Okay. Was this during practice or a game? Were they coming, straight at you? Okay. Okay. Is there anything that you've noticed, a bad headache? Has your vision been blurry at all? Have you had any problems hearing or kind of changes with sensation or anything like that? Just anything that you can think of, really. Okay. Okay, that's good to hear. So hopefully this will just go completely smoothly, and then we can just get you some medication, and we'll just get you home and treat you for a concussion if you have one. But yeah, so I'll go ahead and get my tools together, and then we can get started. Great, okay. Okay, perfect. So right now, all I want you to do is just look directly at my nose, and I'm going to just look into your pupils with this light and see how they react, if they're reacting normally to the bright light, okay? So just look directly at my nose, don't look directly into the light. Okay. Okay, and now I'm just going to pass the light over your eyes and see how they react. Okay, great. So now next I would like you to just follow the light with your eyes. Don't try not to look directly into it, but just follow where it's heading, okay? Good, okay. Great. So the next thing I'd like to do is just test your peripheral vision. And if you could just follow this pen and tell me when it leaves your vision, okay? So just look straight at my nose. I'm sorry, don't follow the pen. Look straight at my nose. And I'm just going to move this pen, and you tell me when you can't see it anymore. Okay, good. 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 great job. So next thing, I'd just like to do a quick eye test. This isn't going to be too rigorous like you normally get at the eye doctor, but just to double check that you're still seeing letters correctly, okay? Can you read line 4 for me? L, good. P, good. E, good. D, good. Okay, what about line 6? E, D, F, C, P. Great. Okay, let's do one more. Can you read this last line for me? F, good. E, L, O, P, C, and D. Great job. Okay, perfect. So the last eye test that I just want to do quickly is just to follow my finger. This is another one to make sure that your pupils are reacting correctly so I can see whether or not you're able to focus on my finger as it gets closer to your face. So just stay completely still. Just follow my finger. Just look directly at the tip, okay? You're doing a great job. And perfect. You're doing a great job. Okay, now we'll move on. So now I'd like to move on to just doing a couple of hearing tests. So the first thing I'm going to do is just come close to you and whisper a series of words, and I'd just like you to repeat those back to me, okay? Are you ready? I'm just going to come close to you and whisper the word, okay? Perfect, okay. Shape. Shape, good. Royalty. Royalty, good, okay. Strategic. Strategic, excellent. Picnic. Picnic, great, okay. I'm gonna just get to do the same thing with a series of numbers, okay? Great, okay. 8. 8, good. 17. 17, good. 700. 700, okay. 34. 34, great. So I have one more quick hearing test. In this one, I'm just going to hum a note, and then immediately after I'm going to hum a second note, and then you'll just tell me whether the second note was higher or lower than the first one, okay? Okay, here comes the first note. Second note. Good, okay. Let's do a couple more. Great, okay. One more. Great, okay, perfect job. So the next sense that I'd like to cover quickly is a sense of smell. So I just have a little vial here, and I'm going to put it up to your nose, and all you'll do is tell me what you smell, and these should be fairly recognizable flavors, so we shouldn't have any issues. I'm not going to give you anything too exotic or crazy, okay? Great. So just stay right there. Okay, here comes the first one. Oranges, great. Okay. And the second. Peppermint, great. And the third one. Vanilla, excellent. One of my favorites. And just one more. I know that one's a little out of left field. I'm sorry to follow all the sweet flavors with that. And now we're going to do a similar activity, but with your sense of taste. So if you would just stick out your tongue, and I have my little spray bottle here, and I'll just spray a flavor directly onto your tongue, and you'll tell me what it is. And once again, these should be pretty recognizable flavors, okay? Okay, so go ahead and stick out your tongue. Coffee, yeah, okay. Second one. Chocolate, perfect, okay. Okay, 2 more. Bubblegum, great job. And last one. Marshmallow, perfect. So now I'd like to just quickly test your sensation on your face. Make sure that everything seems normal there. So all I'm going to do first is just touch different parts of your face. And you can just let me know where you feel my touch, okay? Great. Good. 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 Great. Great. And good. Perfect. 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 And one last test to do with the sensation in your face. I just have my little regular old paintbrush here. And I have both the harder, pointier side and this brushier side. So I'm just gonna kind of go like this on your face, and you will tell me if you can feel either the hard or the softer, brushy side. I promise not to poke you too hard. Okay, so just close your eyes again. Good. 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 And great. So the very last thing I'd like to do is just test your facial control. And you seem to have done relatively well during this exam, but just to make sure that you can do all of the faces, expressions that you normally would. So if you would mind just raising your eyebrows. Okay, now furrow them. Perfect. Now can you stick out your tongue? Perfect. Can you smile? And frown. And can you make a shocked face? Good job. And can you blink 3 times? Perfect. Awesome. Okay. So with all of our testing, it seems like relatively everything is fine, which is great to hear after such a nasty bonk. So what I would recommend is just going home, taking aspirin, and having someone watch you for at least 24 hours. And they will need to wake you up every hour if you do fall asleep, just to make sure that things are okay. If you do experience any other symptoms, like, for example, if one pupil is larger than the other, if you're disoriented at all, if any of the things that we tested today seem to be bothering you, then please just don't hesitate. Go straight to the emergency room. But I would say that you will be fully recovered with just a couple of ice packs on that bruise, and you'll be good to go in just a few days. Great. So thank you so much for coming in today. I'm really glad that you did come in to get this checked out. But like I said, everything should be back to normal within a couple of days. And please do just go straight to the ER if you have any issues. And other than that, I hope you have a wonderful rest of your day. Alright, thanks. Take care. Hi. So I heard that you just took quite a tumble. Yeah, you were downhill skiing. That can be so dangerous. I feel like people don't really realize it because it's such a popular sport. But thank God that you were wearing a helmet, and I'm very glad that they were able to bring you straight to me. So we can do just a quick exam and check you out just overall, and then assess you for any head injuries. Like I said, thankfully you were wearing a helmet, so that's good. Don't expect to see anything too major, but we do like to just be very thorough, as sometimes these things can kind of hide from us. But overall, how are you feeling? I know this just happened, so you might be in a little bit of shock. Good, okay, so overall, feeling okay? Good, okay, that's good to hear. Just to quickly check, I know they probably did this in the field, but just to double check, do you know your name? Okay, and do you know where you are? Aspen Snowmass, exactly. And do you know what year it is? Perfect. And who the president is? Perfect. Okay, great. That's a great sign. So I definitely want to do a pretty thorough exam for any kind of head injury that we might be seeing. I know I heard that you did kind of a rolling tumble down the hill. Was that your first time on that slope? Graduating from the bunny slope. It's so much fun out there, but if you're not ready for it, it can be a lot. So I'm just going to start by doing a quick visual exam of you, just to look for bleeding, broken bones, anything along those lines, okay? Okay, so just checking the body for any external bleeding in the arms. Okay. I'm not seeing anything that looks obviously broken. I'm not seeing blood anywhere. Check your legs. Okay. Visually, things look good, except for a few bruises, which is to be expected. Are you feeling any pain anywhere? It looks like you're holding your wrist a little bit. Just in the wrist? Okay, let me see that. Can you bend your fingers for me? Okay, and can you move your wrist back and forth, side to side, and then in a little bit of, okay, it hurts when you do that. Okay. Well, it doesn't seem to be broken, which is a great thing. I think we're probably looking at a minor sprain, so I will make sure to get that wrapped up for you. And I would just suggest I'll write you just a prescription for an aspirin regimen for a couple of days. Other than that, I would suggest icing it when you get back to your room. But I will wrap that up for you just to kind of keep it a little more stable and prevent some more of that pain or any further damage, okay? So we'll get that taken care of before you leave. Okay, perfect. Do you feel any pain anywhere else? Okay, great. Just a little bruised up. Yeah, okay, that's kind of what I expected. So next I'm just going to go ahead and check your vital signs, and check for any signs of internal bleeding. Once again, don't worry, I don't expect to find anything major, but this is definitely just a precaution, okay? Perfect. So I have my stopwatch right here. If you wouldn't mind just holding out your wrist for me so I can just check your pulse, okay? Okay, perfect. Thank you. Okay, so your pulse looks good. We're hovering at about 70 beats per minute, which is perfectly normal. It seems to have come back down. I'm sure it was racing a little bit right after the accident, but things look good now. So next I'm going to go ahead and check your heart for any signs of a regular beat that might have, come from the shock of the accident or anything like that, and check your blood pressure as well. So if you'll just give me one moment, I'll go ahead and grab those tools. Perfect, okay. Okay, so if you wouldn't mind just lifting your top up for me. And take a big deep breath in for me, okay? And let it out. Okay, and one more. And let it out. And one more. Let it out. One more. You're doing great. Okay, and now just breathe normally for a moment. Okay. So everything sounds good there. So next I'm just going to take your blood pressure. Would you mind just removing your ski jacket and rolling up your sleeves for me? Perfect. I know you're all bundled up against the cold. Okay, I'll just give you a second. No rush. Perfect. Okay. So just hold your arm out, and I'm just going to go ahead and take this, wrap it around. And then I have this little thing that shows me what your blood pressure is as I squeeze this ball, okay? So, just breathe normally for me, okay? Okay, perfect. Things are looking perfectly normal there too, okay? And you can leave your top normal for this part. I'm just going to gently press on a couple different places in your abdomen and then in the sides of your neck, just looking for any pain that we might have missed, any signs of internal damage or bleeding, okay? So I'm going to start with your abdomen and then I'll move up to your neck, okay? So I think my hands are warm, so this shouldn't be too much of a shock. Do you feel any pain when I press right here? No? Okay, that's perfect. Okay, and what about here? No? Okay, good. And then let me just press on the sides of your neck. Let me know if it's too much. Any pain in this area right here? No? Okay, great. And then towards the back of the neck. Any pain? Nothing? Okay, great. Okay, I think we're looking in fairly good shape. Okay, so I would say that overall, things are looking great, looking like we're in good shape. The the next thing I want to do is just the same as I did with the body. Check your head, your scalp, and your face for any visual signs of bleeding, any abnormalities, anything that might need further investigation, as well as do a little bit of a shortened version of a cranial nerve exam that you would get at a neurologist office, just to make sure. We'll check all of the senses, and we'll check your facial muscles just to make sure that nothing was damaged during the fall. And after that, you should be good to go. Okay, perfect. So just hold still. I'll just... No pain in your jaw, anything like that. Okay, great. Your face looks normal. Your nose feels okay. Okay, and then check the top of your head. Things look good. I'm just seeing kind of a small bump right here towards this area of your head. It appears to be surface level, so I'm not too worried about it. Same as the wrist, I would definitely just suggest maybe throwing some ice on that when you get back to the room. Kind of put it on and off for a couple of hours and it should go down. I'm not too worried, but as I said, I would like to do just a short cranial nerve exam just to make sure that nothing's hiding in there. So we'll go ahead and get started on that if that's okay. Okay, perfect. Okay. So first, I'd just like to make sure that your pupils are reacting normally. This can kind of let us know if there might be a concussion or something like that. So if you would just look at the tip of my nose, I'm going to take this light, it's not too bright, and just pass it over your eyes, okay? Pupils do seem to be reacting normally, which is a great sign. If you could just keep your eye on this finger as I move them back and forth. And then look straight at my nose and tell me when you can no longer see my fingers, okay? Okay. Same thing. Okay. And okay, perfect. Perfect. So next I have a couple of different smelling bottles. So what I'll do is I'll just hold each one under your nose for a second, give you a moment to take a big deep breath in, and then have you just tell me what you're smelling, okay? Perfect. And these should all be very common, well-known smells, so no tricks, I promise. Okay, so here's the first one. Just take a big deep breath in. Coffee. Okay, great. And sugar cookies. Good. Christmas trees. Not to theme my exams for this time of year or anything. And last one. Peppermint. Perfect. Okay. So the next thing I'm going to do is just touch a couple different places on your face while your eyes are closed. And if you could just tell me where you feel my fingers, okay? Perfect, okay. So close your eyes. Mm-hmm. 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 Perfect. That one was a little bit of a trick. And last one. Perfect. You're doing amazing. Next I have just a normal brush. So what I'm going to do is I'm either going to touch you with the soft side or the harder pokey side. And just tell me what you're feeling, okay? So close your eyes one more time. Great. Perfect. Perfect. Mm-hmm. 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 And perfect. Great job. So the last test that I want to quickly do with you is a little bit of a silly one. It's just to test the muscles in your face. And obviously, as we've been talking over the last little while, I have noticed it seems like things are good, but we do just want to make sure. So I'm just going to pull a few faces, and if you wouldn't mind just mirroring them back to me, that would be great. And then if that all goes well, which I'm sure it will, we will wrap up your wrist and get you out of here, okay? Perfect, okay. So we're going to start with just a soft smile and a big one and a pouty face and look surprised and angry. And can you close one eye and the other? Can you raise your eyebrows and lower them? Perfect. Okay. Looks like everything is looking good. So let me just grab my gauze and we'll go ahead and get your wrist wrapped up. Okay. So I see that you do have a little bit of a scrape on the wrist area. You probably landed on it fairly hard. So I just have a quick antibacterial wipe that we're going to go ahead and use on the area before I wrap it. And of course, you just saw me wash my hands and use hand sanitizer. So if you just hold it out for me. Does that hurt? Okay, good. Perfect. Okay. Looks like we got the little bit of dirt out of there that was in there. And next I have my gauze. So we'll just go ahead and wrap your hand up. use a little bit of medical tape to hold that in place, okay? Okay. Does that feel secure? Okay, perfect. So, overall, I would say that you are very lucky. You don't seem to have any major injuries, no broken bones, very minimal head trauma, mostly just a mildly sprained wrist. So I would say stay off the slopes for the rest of the day. Give that lump on your head a little bit of time to go down and your wrist a bit of time to feel better. I'm going to send you home with an ice pack. All you need to do here is shake the bag, and then there's kind of an inner pouch on the inside. You can squeeze it or have someone squeeze it for you since your wrist is injured, and you'll feel it break, and then it'll get cold for you pretty quickly. So I would say just keep that on for maybe 20 minutes. Take it off for 20 minutes. Just kind of keep going back and forth like that. And just take some over-the-counter pain medication for it. Just as often as you need it, just follow the instructions on the back of the bottle. And other than that, I would say don't try that particular slope again. But you should be able to be back on the slopes maybe tomorrow afternoon, just depending on how you're feeling. Just come back and see me if anything else crops up. Obviously, go straight to the emergency room if you are feeling dizzy or confused, faint, if you have sudden bad headaches or neck pain, anything like that. Just go straight to the emergency room, call 911, do not pass go, and yeah, you should be good. And I really hope that you enjoy the rest of your vacation. Absolutely, I'm so glad that I could help. I hope you feel better. Just give me a call if you need anything else. Thank you. Okay, have a great rest of your day. Good morning. How are you doing today? Great. I'm so glad to hear that. I'm Dr. Heather. It's so nice to meet you. So I see that you are in today for a sports physical. You must be headed back to school soon. That's really exciting. So what sport do you play? Great. No, I was never super athletic at school, but I always admired everybody who got really into their sports. I thought that was so cool. Well, today should be a pretty straightforward sports physical. We'll do a couple different things just to check that you are all good and healthy to play this season. And then, barring anything unforeseen, at the end I'll give you a form to take to your coach and let them know that you are ready to play. How's that sound? Great. So I'd love to start by just getting some basic information from you. I know a lot of this is already in our system, but we just like to make sure that things are up to date, okay? Great. Would you mind spelling your full first and last name for me? Perfect. And can you confirm your date of birth? Wonderful. And what grade are you entering into this year? And what's the name of your school? And I see here that we have your mother listed as your emergency contact. Is that still correct? Perfect. And she is at the number ending in 1105, correct? Wonderful. Perfect. Now I'd just like to ask you a few questions about your general health, just to see if there's anything that immediately stands out that we should address, okay? Great. So, are you currently taking any kind of medication, whether it's prescription, or over the counter, maybe something prescribed to you by another doctor? Okay. Have you ever passed out or felt uncomfortable or pain in your chest during exercise or in, the hours after exercise? Do you know of anyone in your immediate family that has a serious heart problem? And that would include your grandparents, aunts and uncles, parents, brothers and sisters. Okay. Do you know of any other serious illnesses in your immediate family, or have there been any recent deaths? Great. Have you ever had a broken bone, a ligament injury, muscle strain, anything that kept you from playing your sport maybe last season or in previous years? Have you ever suffered a head injury or a concussion, anything like that? Have you ever had a seizure? And do you wear glasses or contacts? And finally, have you ever taken any kind of supplements to help you gain or lose weight for your sport or gain muscle, anything along those lines? Great, okay, perfect. We have to ask that last one. Wonderful. And lastly, I'd like to just confirm with you, is it okay if I touch you during our exam? If you ever feel any pain, uncomfortability, anything of that sort, feel free to let me know. We can stop, we can move on to something else, anything. Great. So the first thing I'd like to do is just quickly measure your height. This should be super fast. If you'll just back up against the wall, I'll just lean towards you. Perfect. So it looks like you've grown about 1.5 inches. So that's right on track. It's exactly what we like to see. Just make a note of that. And then, would you like me to record your weight as well while we are here? It's completely optional, but I always like to ask. No pressure either way if you would prefer not to today. Not today. No worries at all. Great, we'll move on. So, of course, I've already washed my hands for this exam, but I'm going to go ahead and just put on gloves just for an extra layer of protection. Wonderful. So, in this part of the exam, I'm going to be taking your blood pressure and checking your heart rate as well as your heart and lungs. If you wouldn't mind just rolling up your sleeve and sticking out your arm so I can quickly measure your pulse. Awesome. Thank you. Perfectly normal. Now, if you would just roll your sleeves up as high as you can so that I can go ahead and take your blood pressure. Perfect. And I'll just go ahead and wrap this around your arm. Great. Perfect. Wonderful. 110/70. Looking perfectly healthy there as well. Great. Now, if you wouldn't mind just sliding towards the edge of the bed, I'm going to go ahead and take a listen to your heart and your lungs, just to listen for any kind of murmurs, any trouble breathing, anything like that. Okay? Great. So if you could just breathe normally for me. And then if you could take in a big deep breath, as much as you can take. And let it out. And one more. And let it out. Your heart and lungs sound great. No problems there that I can find. Perfect. So the next thing I'd like to do is just quickly check your reflexes and then examine a couple of spots on your body just to ensure there's no pain or discomfort. Okay, does that sound good? Great. So if you could kind of move back towards the edge of the bed and just let your legs sort of dangle from the knee, that would be perfect. Wonderful. So I have my little hammer here. I'm just gonna quickly tap on your knee. Shouldn't hurt at all. Perfect. And one more. Perfect. And then if you would hold your arms out for me as well, I'd like to just check your elbows. Great. And great. Wonderful. Everything looks wonderful. Do you mind if I quickly just press on a couple of areas of your stomach and then as well your neck to ensure that there's no kind of spinal pain, no injuries, and that everything looks good in your core? Perfect. So you just kind of sit there and just breathe normally. Just 1 second. How does it feel when I press on this area? Okay. What about right there? Great, okay. And let me just check your neck as well. Make sure there's no pain. Okay. Your glands feel good. And just your jaw. Can you just press down with your lower jaw into my hand? Great, perfect. Everything looks good. Great. So we are getting towards the end of our time together. As you mentioned that you do wear contacts, I would like to just quickly give you a super simple vision test. It's not going to be as thorough as what you'd get at a normal eye doctor, but just to make sure that your prescription seems up to date, okay? Can you read this line right above the green? Wonderful. And how about this right below the red? Great. And then what's the smallest line that you feel like you can comfortably read? Perfect. So the last thing I always like to do during these physicals is just check in with how you've been feeling mentally, emotionally, all of that. So how have you been feeling lately? Have you felt more sad or anxious or angry than normal? Good. And how has your sleep been as well as your eating habits? Great. And do you feel like you have a good support system around you between your family, your school, and your friends? Wonderful. And is there anything else that we didn't cover either in this section or any other that you'd like to chat about today? Great. Well, it's wonderful to see that things seem to be going well. If that ever changes, please feel free to just give my office a call and we can work on setting up a plan to together to kind of get things back on track. I know that high school is a very difficult time without even adding on all of the athletics and extra things that you do. So just like to keep an eye on that over time. Great. So we are all done for today. All that you need to do now is take this form to your coach that I filled out, and it'll let them know that you are all good to go to play this season. And then you can just check out at the front desk, and they will help you set up another physical for after your next birthday. Great. Well, it was a pleasure seeing you today. Thank you so much for coming in, and I'm sure we'll see each other again soon.